Last Friday could have been the last time one of the doctors at the Accra Psychiatrist Hospital would have been alive if not for the swift intervention of a nurse and some staff. It was a normal Friday for him until the unfortunate happened. An hour before the attack, he had attended to a patient of Chadian nationality. He recommended the patient be admitted so he could be properly observed and treated. The nurse, who was assisting the doctor in the consulting room, recounts moments leading to the attack.
So I was just sitting here, and then the patient just barged in, picked his medication, which was on my table, and then started staring at me. So I became scared. Then, fortunately for me, the patient didn't do anything to me. Then he just went out again. Then I quickly moved out of the office, informed my in charge about it. Then after that, I went to special ward to look for some guys to come and help. So when I was coming, I saw the doctor and the patient plus the patient's relative moving towards the office. So I stood there to wait for him. But when the doctor got here, he just entered the office. Then the patient quickly followed him. So I was about to follow him so that we can help restrain the patient. But the patient said something to me. Then I got frightened. Then I moved back. Then the patient locked the door, the first door. Then he followed the doctor to the main office and locked the doctor's door. So I went to stand in front of the main window, doctor's window, to see what is happening inside. Then I realized the patient was pacing up and down in the room, but I didn't see the doctor.
Her insistence to get the door broken saved the doctor's life.
I asked the guys to break the door, and they did. They broke the two doors. When we got in, the patient was strangling the doctor.
Health workers across the board have to be given the needed motivation to work. But for health workers dealing with mentally ill patients, it is obvious that extra care and attention be given to ensure their safety. This is lacking, and the director of the Accra Psychiatrist Hospital, Dr. Pinaman Apel, says some of the staff have threatened to resign because it appears their safety is not being prioritized.
My prescribers are threatening to stop work because they cannot see themselves working in these unsafe environments. So we continue to appeal to the government. We need this place to be torn down and rebuilt, built to have to make the place friendly both to patients and to staff, so that we'll both be happy working in the facility.
The facility also has one entry that also serves as an exit. There is no alternate point of escape in case of an emergency. Dr. Apel is appealing to government to help improve the infrastructure at the facility. Staff of the hospital think it is about time this plan is prioritized.
The system is very bad. And 2, in our consulting rooms, we don't have emergency exits. And 3, the nurses and the doctors here, we are not safe. Because 1, it's like they don't boost us. There is nothing to boost us to work. Look at the condition we are working in.